So hello everyone, today I'll be talking about the meniscal injury as we have done the OA osteoarthritis knee. So I'm giving you the basics. First I'll cover all the condition around the knees, then I'll give you all the treatment, okay, how you can treat in this each conditions. So, and excuse me for my handwriting. I know whenever the doctor gives you a prescription, even the patients have hard time reading it to it. Even me myself, I get difficult in reading what the prescription has written. And sorry for that. That's why I'm not writing in the big letters because my handwriting is not that good. But I'll try to explain you. So meniscal injury, first topic today is, so meniscal injury, knee pain with clicking, locking or tenderness. So that means you might have meniscal injury whenever you feel this kind of symptoms. In OA there's a crepitus sound and stuff, right? But in meniscal injury, what happens? There will be a locking or clicking sound. Whenever you tell the patients to bend or extend, whenever they are moving, they'll feel little bit clicking sound or locking sound, uneasy in their movements. That's the things you have to look out for, okay? So that means you have to look for the clicking or the locking or even tenderness. Whenever they touch around the areas, they might have pain. But what happens? In OA, you touch around the bony areas, they'll have pain. But in meniscal injury, what happens? Go in the medial side, that means the medial meniscus, go and touch there, they'll complain of pain there. Go in the lateral side, they'll complain of pain there. Whereas in osteoarthritis, what happens? You go around these bony lines, they'll have tenderness. So that's the thing. Whenever there's a meniscal injury, go and touch around that medial side, they'll complain of pain. Okay? And look for the clicking and locking symptoms whenever they are walking. And the cause can be of meniscal injuries, usually happens due to twisting or impactful force. That means whenever you twist, even me, I have already injured my meniscus while playing sports injury. That means I usually play basketball. I have already injured, so I know how it feels. So impactful, that means whenever there's a sports injury, you get twisted and there can be a tear. Sometimes there can be a tear with the meniscal, that means avulsion fractures. With the ACL, the bone comes out from its place. And there are types, okay? Whenever there's a meniscal injury, there are types. The way you see the patterns in the meniscus, how they are torn. So there will be longitudinal, radial and bucket handle. So these are the patterns which are normally visible in the MRI whenever you see the meniscal injury. Third point which I'm going to talk about is the symptoms. So symptoms will be pain, joint line tenderness, locking or clicking sound you feel while moving. That means whenever you feel you're taking a walk or taking a steps, whenever you're moving around, these are the things you're going to look for. Either you have a clicking sound while walking or locking, or there's a pain, or when you touch the area, that's called tenderness. What exactly means tenderness? Means some people, they might know, I'll just explain you. Tenderness means this is not pain. So when I go and touch in that area, they feel pain. That's called tenderness, okay? Pain on palpation, that is called tenderness around the areas where they're looking for. So what happens? What is the tenderness? Tenderness means whenever you touch the area, they feel pain. That's called tenderness. Okay. So there are two normally used special tests for ruling out the meniscal tear. So there's two tests are McMurray test and Aplis test. So what happens in McMurray test? Here we see pain or clicking during rotation. So whenever you do the test, you have to rule out whether when you're doing the rotation, is there pain or not. And second is your Aplis compression test. Pain with compressions plus rotation. When you put the compression, if there's pain, and you apply rotation if there's pain, you just gonna rule out this. So these are normally used. So you need to know which test you'll use and gives you most result. So next is gonna be a diagnosis. MRI is the gold standard for meniscal tear diagnosis. If you got any kind of this kind of symptoms, it's best to do a early physiotherapy to save your knee. And what happens, even screw home mechanism. As you know, one meniscus is bigger in size compared, or you can say the circumference compared to the other side. So it's screw home mechanism. That's why whenever you extend the knee, the meniscus plays a very important role in rotating the femur over the tibia. That's why you need to know if it's tear and stuff. You get it? Most common is medial meniscus you commonly see. If not, then if there is varus force on the lateral side, you get, or you can say impulsive force on the lateral side, you can get a tear and stuff, like your road traffic accident or sports injury. So these are the things we have done, the meniscal definitions, cause, symptoms, special tests and diagnosis. So after covering all this condition around the knees, then only I'll give you the treatment protocol, how to do. Because for ACL, we have a stages wise. And for meniscus, we have a stages wise. Because you need to know when, because after meniscus injury or repair, there's a surgical intervention I will talk about later on. Because, and there's certain time period you should not load or put any weight after the surgical repair in the meniscal tear. Same thing goes with ACL. ACL we normally walk after 1 to 2 days. We do weight bearing, but with brace. So there are things why we normally use crutches instead of walker in these things, because we normally don't give a walker. What happens, some people they have stairs on their house, so we give them crutches, give on the side, so they'll, it's easier for them to do. So you need to advise them what to do, what exercise to do, and how you can progress on your daily life. So those things I'll talk in the treatment wise. Okay, so here I'm just giving you the basics. Get clear with the basics, then we'll go move on to the different things. And thank you. If you want more video, which topic you want next, you can comment down below. Thank you.